Hello, America. Welcome to America's Healthcare Advocate Show, broadcasting coast to coast across the USA. I'm your host, Cary Hall. My producer, Mr. Rod Babcock. My special guest in studio today, Rowe, Senior Director, Consumer and Small Group Markets, Blue Cross and Blue Shield of Kansas City. Welcome back.
Thank you, Cary. Glad to be here.
How many of these have we done?
Several.
Several?
It's been fun to watch your show grow over the last 9 years.
Well, you guys have been a great partner. This is going to be an interesting show today, ladies and gentlemen. We're going to be talking about the Blue KC Exchange, what it will mean to small business, what it will mean to employers with 99 employees or less, how it will work, how it will help you as a business control your health insurance cost, and the tools that Blue Cross and Blue Shield of Kansas City is going to give you to control your health care costs. So stay tuned, listen and learn as we talk with Rowe today, who actually designed this program along with his team at Blue Cross and Blue Shield. You're going to find this very interesting and very educational. Thank you for making us one of the most listened to talk shows across the United States. I do appreciate all of your emails, feedback, and phone calls, and I answer every one of them. We get about 200 a day now, so it takes a while sometimes, but I will get back to you one way or another. We appreciate your listening to the show. Please tell your friends, neighbors, and coworkers about us. Make an appointment to join us each and every week for America's Healthcare Advocate Show, broadcasting here on the HIA Radio Network. All of these shows are streamed live on the internet. If you're out of the broadcast area, you can go to my website, americashealthcareadvocate.com, americashealthcareadvocate.com. Click on that local radio logo, and you can listen to the show on your computer. Now, you hear this today, and maybe your boss is having trouble with the health insurance plan. Maybe you're the HR director, or maybe you're a husband and wife team that own a business and you're struggling with the cost of health insurance, and you're going to try to regurgitate all this back to somebody after you heard this show today. Better idea. Go to the website Monday at 2:30. The show is posted up there. You can go listen to the show just like we did it in studio. So all the information will be there. Go to the website americashealthcareadvocate.com. Monday at 2:30. The show is posted up there. I do not take calls in these shows because we are trying to get as much information out to you as possible. But if you have questions, 877-385-2224, the number I always give out at the beginning of the broadcast. There are operators standing by. If you have questions, call. We'll get back to you after the show with the answers. Once again, that phone number is 877-385-2224, or you can always email me at americashealthcareadvocate.com. Okay, Rowe, what is a health insurance exchange?
Well, a health insurance exchange is an online marketplace. It's a place for people to go to purchase their health insurance. The concept of an exchange is really nothing new, but the thing that has really made exchanges real popular is the healthcare reform law that was passed in March of 2010. Everybody knows it as reform, or the Affordable Care Act addresses that exchanges in 2014 will become one of the primary means for small employers and individuals to shop for and purchase health insurance. Those were mandated by the federal government, but they're going to be run by the individual states. So that was part of the healthcare reform bill. The Blue KC exchange, which is the exchange that we just launched for small employers in the Kansas City area, is modeled after the exchanges that will come about in 2014 with healthcare reform, and the big difference with the Blue KC exchange, if you will, is that it's a new way for small employers, and small employers we define as under 100 employees. It's a new way for them to purchase their health insurance. Totally different new way to purchase health insurance. Today, a small employer meets with a broker or their consultant and looks at all the different plans that are available. And then the insurance company says, for your company, this is how much one of these plans is going to cost for you.
So one size fits all.
Exactly. One size fits all. It's known as a defined benefit. Here's the benefits. Now here's how much these benefits are going to cost your company. The exchange gives the employer the ability to do exactly the opposite. Instead of an insurance company saying, this is how much it's going to cost, the employer says, here's how much I'm going to pay. I'm going to give all my employees $300 a month, for example. And then the employees can go out onto the exchange, take that money that I give them, and buy whatever plan they want. That's how the Blue KC exchange is designed and works in a nutshell. That the employer determines how much they want to pay, a defined amount or a defined contribution instead of a defined benefit. Then the employees get that money, and on the Blue KC exchange, they have 10 different plans that they can choose to purchase from.
Let's go back to that, because I want to make sure the audience gets this. This is, as you said, a defined contribution, not a defined benefit. What we've had in the past is we're going to buy X plan from Blue Cross and Blue Shield of California, and if you're 50 years old, that's the plan you're going to get, and if you're 25 years old, that's the plan you're going to get. The flexibility hasn't been there to adjust to the individual employee's needs.
That's correct. And some employers and insurance companies, what we've done over the years is try to give the employer and the employees a little bit more flexibility. And maybe they'll have 2 plans or 3 plans. But at the end of the day, everybody's got a set of benefits that they're all getting in that company. And the employers do that based upon what they can afford. It may not be necessarily what the employees want or what the employees need, but it's done based off of what can the employer afford. What set of benefits can I afford to offer my employees? And then when it comes time to renew, and we'll get into this a little bit later on down the road, which is one of the beauties of the Blue KC exchange, is we see employers every year having to change what it is that they can afford to offer their employees as rates go up.
And you see that because what you've got all this pressure on insurance carriers with all the different changes, and you've got the pressure with new medical technologies coming into play. You've got a Da Vinci robot now that costs $1.5 million between here and Wichita. There are 13 of those machines. You've got brand new medications out there, Avastin, $50,000 for one course of treatment for cancer. That's being paid for by the insurance carriers, which puts pressure on the carriers price-wise, because benefits in terms of technology, what's available, and drug use, we're getting better and better and better, but it all costs money.
It all costs more. And what you're hitting on, Cary, technology is only one factor that's driving up the healthcare cost. You have the technology that you just talked about. You have the fact that we're an aging society, and as we get older, we use more health benefits.
Are you looking at me when you say that?
No, okay. We're an aging society, but medical inflation in general. I mean, the point is, healthcare costs are not going to go down anytime soon. You look at the obesity rates in the United States. You look at the fact that we're an aging society. You look at the technology there's several factors that are contributing for healthcare costs to go up. And at the end of the day, the employers are the ones that bear the burden of that cost. And so each year when an employer gets their renewal and cost goes up, or the individuals that are buying on their own get their rate increases, that is a direct result of the amount of claims that an insurance company pays. Insurance companies, whether you're a for-profit company or whether you're a not-for-profit company like Blue Cross and Blue Shield of Kansas City, or whether you're the federal government and it's Medicaid, at the end of the day, you can't pay out more in claims than you take in premiums, before you even start talking about profit or not profit. So as those claims trends go up, the rates are going to go up off to the employers. The private exchange and defined contribution in specifically is a great way for employers to control those rising healthcare costs.
Right. And the people this falls heaviest upon, the group that, as a broker that I deal with, and the part of one of the big areas of Blue Cross and Blue Shield that you oversee, is small group, 2 to 99. It's the small group employers that have the most difficult time trying to cope with this. And so what do? They raise the deductible, they lower the benefits, they try to move the thing around, try to massage it to make it work and keep going. What you're saying here, there's a totally different approach to this now.
Totally different opposite approach. Under the scenario you just gave, the employer does try to pass on those increases to the employees, but they don't pass on to the employees in terms of, or today they don't at least, in terms of saying, we're going to take more out of your check or you're going to have to pay more. What they do is they take that defined set of benefits that we talked about and they make those benefits less rich. Okay, the most perfect example and the most common is raising a deductible. An employer has a $1,500 deductible in place for their employees, and now at the renewal time, because of the increase, they got to raise it to a $2,000 deductible or a $2,500 deductible. And so what the employer does is they pass on the cost by giving a lesser benefit to the employees.
And that's one of the things that this exchange changes is the way that works. It gives as I said earlier, if you're the 55-year-old and you want an HSA account because you're an empty nester and don't have kids at home, you can do that and you're going to pay less. If you're the 30-year-old with 3 children at home and you need first dollar benefits for all kinds of things, you can take your $300 or $400, whatever the employer is going to contribute, and apply that to that policy. That's basically the philosophy.
That's exactly the philosophy. At a very high level, that's it exactly.
And that's what we're trying to do here, and that's what happens with the exchange. When we come back after the break, we're going to get into the weeds a little bit on defined contribution, defined benefit. We're going to draw some parallels to this that you'll understand that'll really clarify this as we talk more with Ron Rowe from Blue Cross and Blue Shield about the Blue KC Exchange. We'll be right back after the break. You're listening to America's Healthcare Advocate, broadcasting on the HIA Radio Network, coast to coast across the USA.